Headaches. You probably had one, maybe even today. They're like one of the most common things people complain about, right? But here's the thing. Even though that pain can feel super familiar, not all headaches are the same, not even close. So let's dive in and figure out what that pain in your head is really trying to tell you.
I mean, we've all been there, haven't we? You're at your desk, you're trying to focus, and then, boom, there it is. That nagging pressure, that dull ache. It can totally derail your entire day. And yeah, most of them are harmless, but some can really seriously mess with your life and your ability to get anything done.
So the real question is, what's going on here? Is this just, a headache? Or is it a sign of something else entirely? Figuring that out, that's the first, most important step to actually getting the right kind of help.
Okay, so to start figuring this out, we need to get inside a doctor's head for a second. They basically split headaches into two main categories, and believe me, this first split is the most important one.
Okay, so on one path, you've got what are called primary headaches. The easiest way to think about these is that the headache is the main problem. It's not a symptom of something else, it's the condition itself. We're talking about things like migraines and tension headaches. Then, on the other path, you have secondary headaches. These are totally different. They're like an alarm bell going off in your body. The headache is just a symptom that something else is wrong, maybe an infection, an injury, or even high blood pressure. So, right off the bat, we have to figure out, are we dealing with the main event, or is this just the alarm bell?
All right, let's start with the one most of us are, well, painfully familiar with. This is the usual suspect of head pain. It's the most common type of primary headache out there.
Yep, we're talking about the tension headache. And the classic description is spot on. It really does feel like a tight band is just squeezing your head. It's this dull, aching pain that can just linger.
So, how can you be sure it's a tension headache? Well, there are some key clues. First off, notice the location. It's usually on both sides of the head. That's a huge tell. The feeling is that dull, mild to moderate ache. But here's the real kicker, a little diagnostic trick. If you can get up, walk around, and your normal physical activity doesn't make it worse, chances are you're dealing with a tension headache.
So what triggers these things? Well, it's pretty much a greatest hits list of modern life, isn't it? Stress and anxiety are massive triggers. So is that terrible posture we all get from staring at our screens all day. Add in some eye strain, not getting enough sleep, and all that tension we hold in our neck and shoulders, and you've got the perfect recipe for a tension headache.
Okay, so that's the common tension headache. Got it. But now we're about to step into a completely different arena. We are shifting gears from a simple ache to a full-blown, complex neurological event. This is so much more than just a bad headache. This is a migraine.
Seriously, a migraine is a whole other beast. It's not just pain, it's a neurological disorder. And its signature move is this intense, throbbing, pulsating pain that's usually only on one side of your head. What's happening is basically waves of activity firing across your brain, messing with blood vessels and just screaming pain signals.
And you can see just how different it is when you look at the details. First off, location, unilateral. That means one-sided. That's a massive clue. The intensity is way up there, moderate to severe, and these things can last for days. But maybe the most important difference is that last point. Physical activity makes it worse. We're not talking about running a marathon. Even just walking up a flight of stairs can make the pain explode. That is a world away from a tension headache.
But believe it or not, the throbbing pain is only part of the story. Migraines bring a whole entourage of other awful symptoms with them. For a lot of people, that includes something called photophobia, which is just an extreme sensitivity to light. You just want to lock yourself in a dark room and hide from the world.
And on top of being sensitive to light, you might get phonophobia, that's sensitivity to sound. Then there's the nausea, sometimes even vomiting, and this crushing fatigue. See, it's not just a pain in your head, it's a full-body assault that can totally shut you down for days.
And get this, for about a third of people who get migraines, their body actually sends out a warning signal before the pain hits. It's called an aura. It can show up as visual stuff, like seeing flashing lights or zigzag patterns. For others, it might be tingling sensations or even trouble speaking. It's basically your brain's way of saying, brace yourself, a migraine is coming.
All right, now we're moving on to our third type of primary headache. Now this one is much, much rarer than tension headaches or migraines, but it is infamous for just how severe it is.
Let me introduce you to the cluster headache. And when I say this is intense, I mean it. This is widely considered one of the most severe pain conditions known to medicine. People who get them have described the pain as worse than childbirth or passing a kidney stone. It's just this excruciating, sharp pain that hits you out of absolutely nowhere.
The way a cluster headache presents is super distinct. You really can't mistake it. The pain is brutal, and it's always one-sided, almost always focused right around one eye. That eye will often get red and teary. Now, the attacks themselves are pretty short. We're talking minutes to maybe a couple of hours. But here's why they get their name. They happen in clusters. You might get them several times a day, every day, for weeks or even months. And this cyclical pattern is probably linked to the part of your brain that acts like your internal clock, the hypothalamus. Then, just as suddenly as they started, they can disappear for months or years. And one last interesting fact, they're way more common in men.
Okay, we've covered the big three primary headaches, but now we have to talk about something that is really important, and that's knowing when a headache isn't just a headache, when it's a red flag. So I need you to really listen to this part, because while the vast majority of headaches are harmless, sometimes a headache is your body's emergency broadcast system. It's a warning sign for a serious problem that you need to get checked out, and fast.
Okay, these are the red flags. If you ever get a headache that comes on suddenly and is so severe it feels like the worst pain of your entire life, they call this a thunderclap headache, you need to get medical help immediately. Same thing if a headache comes with a fever and a stiff neck, that could be meningitis. And any headache that brings on weird neurological stuff like weakness on one side, confusion, vision loss, or any new headache after a head injury, those are all medical emergencies. Don't wait.
Okay, so that was a lot of information, and some of it was pretty scary. So what's the game plan? Let's talk about what to do, how to get the right diagnosis, and even better, how to stop these things from happening in the first place.
So if you do go see a doctor, it helps to know what to expect. And honestly, the most powerful tool they have isn't some fancy machine. It's you. It's your story. A detailed history of when the headaches happen, what they feel like, what makes them better, what makes them worse. That's gold. They'll also do a physical exam, of course. They'll only usually order things like a CT or an MRI scan if they see one of those red flags we just talked about and need to rule out something more serious.
But honestly, for most primary headaches, especially tension types and migraines, the best treatment is prevention. The best long-term strategy isn't just reacting to the pain when it hits, it's stopping it from happening to begin with. And the really good news? There's a lot you can do about it.
And this is basically your personal prevention toolkit. It really boils down to the fundamentals, right? Getting enough sleep, staying hydrated, finding good ways to manage your stress. Getting regular exercise is also a huge one. But the final piece of the puzzle, and maybe the most important, is you have to become a detective. Figure out what your personal triggers are. Is it a certain food, not enough sleep, and then avoid them? Because at the end of the day, understanding your headache is the first and most powerful step you can take to finally get control over it.